To difficulty in docking during femtosecond laser. I have no financial interests. So before beginning, I would like to introduce this introductory video. This is a common scenario that is faced in a refractive audio. So the patient is being docked and the machine said to move down. So we had to reposition the head to get a successful docking. So, femtosecond laser is a standard of care for modern refractive surgery. An application of this laser needs accurvation of cornea with a suction cone, which needs to be docked appropriately. An inappropriate docking is a major risk factor for intraoperative suction loss, higher risk of black spots, and hence it's always desirable to have a good docking in single attempt. And in subjects with deep set eyes, novice surgeons often face difficulty as prominent nose, brow, or narrow palpebral aperture interferes with docking. We studied the facial profiles of 97 subjects who presented to us in refractive clinic and attempted to identify certain anthropometric parameters to predict the need of position maneuvering to improve the success rate of docking in single attempt. So it was a single center observational study conducted at our center. So 97 subjects with the age of 18 to 30 years who were planned for laser refractive surgery. Patients with ptosis, periocular masses, or lid abnormalities were excluded. All the subjects were made to sit comfortably on a stool with back erect and were asked to look straight ahead into a fixation target 6 meters away. The front and side taking images were taken from 1 meter distance from the subject. These were the parameters measured on the front facing pictures, that is a vertical palpebral aperture, the horizontal palpebral width, intercanthal distance, interpupillary distance, and the outer canthal distance. On side facing pictures, we measured the distance from corneal apex to nasion, outer canthals to nasion, nasion to pronasal, nasion to subnasal. We also measured the angle between glabella to pronasal and tip of chin. This is called the total facial convexity. And glabella to subnasal to tip of chin, this is called the facial convexity. We also measured the nasofrontal angle, that is between pronasal to nasion and glabella. And all the subjects were operated by a single surgeon on Vizumax 500 femtosecond system. And during docking, the subjects were labeled as normal, requiring no position maneuvering, and as deep set eyes for those requiring position maneuvering on the table. So coming to results, the mean axial length and refractive error in all patients were comparable, and we faced difficulty in 1 female and 18 males. So total 19 patients we had a difficulty. The parameters measured on front-facing and few side-facing pictures were comparable in both the groups. However, we found a significant difference in ratios and angles measured on side-facing pictures in both the groups, especially the depth of eye, which was significantly more in patients with deep-set eye, and the facial convexity, total facial convexity, and the nasal bridge index again was significantly more convex in patients with deep-set eyes. A receiver-operator curve analysis was done, and it was found that for total facial convexity, the value of 133 degrees was found to be a cutoff value with high sensitivity and specificity. So anyone who has a facial profile which is more acute than 133 has a higher risk for the need of position maneuvering. But measuring this angle on image J, as we did in study, is not practical. So we found a practical way, that is using on-screen protractors, which are available on various Android and iPhones. So we can take the picture and measure this angle, which is the most significant and easy to measure. And we got a good comparable values with image J value and the value measured by the on-screen protectors. And hence we validate this method, which can be used. So these are the certain representative images. Now this patient had a total facial convexity of 141. We did not have to do any positioning. Another patient, the convexity is 137. Again, it was labeled as normal. Now this patient has a facial convexity of 122. We definitely had to move her head while docking as the nose got stuck. Another patient with acute facial profile. So limitations of the study are that obstruction might also occur in anxious subjects who tend to lift their chin on the surgical table. And all patients in our study underwent surgery on Vizumax 500. Hence, our findings might not be applicable to other femtolaser platforms. So to conclude, most subjects with challenging docking had a total facial convexity of less than 133 degrees. Side-facing pictures can be taken, and the convexity can be measured using on-screen protectors. And in subjects who have more convex facial profile, a special care must be taken to ensure appropriate docking. We need to do a head maneuvering, that is chin, head shift to the opposite side and a chin down position. Thank you.
It's a nice presentation. It's a deep-seated eye with this proctor you're
So
using.
actually, we just
You can see
labeled.
the nose here. You can measure the nose here.
We have done all the measurements. We also measured the distance between apex of nose to the outer canthus. That gave us an idea of the depth of the eye, but that did not make a difference because the configuration of the femtolaser platform is such that the angle of the nose makes the major difference. So we found a significant difference with that. Other parameters were also measured, but they were comparable in both the groups.
And any difference in the presence of OBL if you're manipulating too much?
So that aspect was not studied in the study, but definitely poor docking is associated with higher risk of OBL.
Thank you.
As a practical application of this study, would you be doing these measurements for every patient who undergoes a femtosecond laser? Would you recommend that?
Well, this is recommended for novice surgeon. If you're starting to do the surgery, it is definitely recommended so that you can choose the cases appropriately because you don't want a bad first experience. So that is an important application. Otherwise, later on, again, it can be used so that you don't have to struggle on table.
So at your center, do you use it for every patient who's undergoing a femtosecond laser?
So yes, we do it.
Thank you. Thank you, sir.
Thank you, sir.